Orimi song, Dr. Binla, it's good to have you on Things Runner.
Thank you very much. I say good morning to you.
Thank you very much for coming as well. Thank you. And so I'd like you to enlighten us on what dirty habits are. When we say dirty habits, the habits that we need to avoid, we need to know what they are before we begin to avoid them. What are dirty habits?
Thank you very much. Let me start by saying that the word dirty itself means something unclean, something ungood, and something that can definitely not speak beneficiary to the health and even the environment. And when we're not talking about habit in itself, I would say habit simply means a recurring, often unconscious pattern of behavior that we acquire or develop through repetition. It could be good, it could be bad, it could be in between, either then or there. And when you say something to avoid, definitely means bad, not beneficial habits that people do practice unconsciously often that can lead to not having good physical health, mental health, or even reduce productivity of such an environment. So these are dirty habits that we must try to avoid. It could be personal, let me say this. It could be personal, it could be environmental, and by the time we delve into this, we bring out more examples of such things.
Alright. I know that you're a medical doctor, and so going by your experience in your profession, what can you enumerate some habits that you tag dirty that we all can learn from so we can resist from doing them and you explain several examples in the course of it.
Thank you very much. Let me start with the word, what I refer to as a personal habits.
Okay.
That is what individual does, often unconsciously.
Okay.
When you have an individual that does not practice regular washing of hands, then that needs to avoid. Because really in an environment that we find ourselves, at a time like this, even right from the time of COVID, we find out that
we were washing hands regularly.
Often we were singing it like song. And I also saw some of the advert that they played on Lassa Fever now to see that people were washing their hands. Because the truth is that if you don't regularly wash your hands, it transmits infections. It transmits infection from one place to the other. But just like we said in the health sector, the bacteria, the viruses don't fly. They don't jump. So you can carry from one place to the other with your hand. So if you wash your hands on a regular basis with soap and clean running water, definitely you are avoiding a lot of diseases. The attitude of not taking your bath minimum once in a day, preferably twice in a day, and having your teeth brushed every day, these are good habits. And if you don't do it, you waste it bad habit, or you have to avoid. And also the attitude of, take for example, buying fruits, vegetables unwashed. And I also want to stress in particular for those that are in hospitals, healthcare workers. We advise them that when you move from one, before you get to attend to a patient, you wash your hands. As soon as you're through with that patient, you also wash your hands. By the time you close, at the end of the day, you want to go home, you must wash your hands. And when you get home, before you start embracing your younger ones or your children, you must definitely wash your hands so that you don't transmit infection from one place to the other. That is one. Also, at home, we also advise that people must wash their cooking utensils regularly. You must clean the kitchen regularly. And you must use what we refer to, particularly at a time like this, we must use what we refer to as rodent-proof or rat-proof container. To contain, for example, your garri,
to store our food.
Store your food adequately well, so that you don't have them infected. Some people just do it unconsciously. Now, whatever they want to do, they just do it carelessly even at home. Unknowing that some of these homes definitely are harboring rodents. And some of these rodents also carry one infection or the other. By the time you deposit such on food, it eats them. And such an individual can definitely come back with diseases.
Alright. I also know that earlier about running water. So what are you implying? Can't we wash our hands inside buckets of water or containers that also have water in them?
It's
Is it preferable, or is it's a medical advice to wash our hands using running water?
Advisable.
Alright.
You use clean running water. Why clean running? By the time you wash,
Yes.
you are not washing it into a bowl that you are going to dip your hand into again.
Okay.
Someone can scoop the water for you while you are washing your hand. It's running it over your hand. It's still running, and the water is still clean. Not necessarily you must have a tap in the way. We improvise in an environment that we have find ourselves understand. It's still running and it's still clean. Instead of doing it in a bowl and you keep putting your hand in that same bowl, it's like recycling that infection in the first place. So that is what I mean by clean running water.
I also would ask you this. There are products, there are beverages that are stored in containers, you know. You have some beverages that are in plastic containers, some in tin materials. But I want to ask you, how true is this assertion that rodents, you know, they most often defecate on those products before we consume them? I want to find out from you. So if we need to consume such products, for instance, if we have to take soft drinks that are in plastic bottles, is it advisable to just buy them or get them out of your refrigerator without cleaning them and just put the bottle in your mouth?
In fact, before you even store them in the refrigerator in the first place, it's advisable you must store it clean. The attitude of just opening, putting it in your mouth, particularly there are some. You see the bottle you are talking about now, you need to remove the cover and put in your mouth. There are some that you need to just open the container and put it directly. Particularly the one that I mentioned secondly now. If you have rodents playing around it, defecating on it, definitely you are eating or you are drinking or you are taking such infection already. So it's always advisable that you must clean, thoroughly clean, and you must also ensure that you thoroughly you safeguard it in an appropriate place to save it from being contaminated. It is true. Not to be infected by just taking a container and putting it in your mouth. If you have rats, particularly those that have carried the Lassa virus, like we have seen regularly, and you now start drinking it directly, not even using a clean cup that you have cleaned and put the whole thing in the cup before you start drinking it, you could be infected. It's like an individual buying an orange. Instead of you having it washed, you just decided to open the skin, the cover, and by the time you are taking it, it's almost certain that you will have carried some viruses or some bacteria, and in that you inject it, and you could come down with one disease or the other.
How true is this, doctor, that there are some cultural and traditional practices that we engage in this part of the world that are actually dirty, that can be tagged as dirty habits?
Let me start with female genital mutilation. It's a dirty habit. Dirty in the sense that if you see the instrument used, the razor used, is a razor that they would have used for a lot of people. And that could carry infection from one person to the other. And I will also say that part of the habit that individually must avoid is using razor that has been used by another person, or sharing items like razor, like tool. If I must come back quickly to the cultural practices that we're talking about, the female genital mutilation is an example that we must run away from. People carry infection, and such an individual that genital has been seriously mutilated. We put a lot of sequelae to follow. That is a practice that we must run away from. And also cultural practice like some rituals. And you find a lot of things that people throw around. Put at what the Yoruba would call Orita Meta, the airballs and the like. A cultural practice that we need to run away from.
Oh, well, that's some people's religion, and we do it.
It could be decently done. And let me also say that the attitude of the widow now, and you say you want to deny them taking their bath for months or days, they have to use the same black clothes, sleep in the same place. These are dirty cultural practices that we need to run away from. Because individuals can easily contact infections through this. And who knows the type of infection it could be. If it is Lassa, it could be very serious.
ask you as an adult that there are people who have spouses and or maybe people who are in a very intimate relationship that share toothbrush. How healthy is this?
Wow.
Is this a dirty habit as well?
It is a dirty habit.
I would assume it's an expression of love or intimacy between a couple.
I don't advise couples to use the same brush. Why must you use the same brush? Is that expensive anyway in the first place?
No, it's
So you can use one for the next, I just do one before you change it. So what is so special about you want to express love? You have various ways of expressing love, don't necessarily using the same brush.
All right. We also know that there are people who carry out their market activities in public places. They sell products that are exposed. How healthy is this? Or can we tag this also as a dirty habit? Take for instance, we buy gari that is put in a bowl and it's just exposed in the market. Some people sell fish that way. Some people sell various edible products that way. Can you explain to us if these are also some form of dirty habits that we should avoid?
Thank you very much. Let me seize the opportunity of this question to say that the State Ministry of Health, Environment and Agriculture frowns seriously at exposing food items, exposing dairy in particular in the market.
All right.
And rice and beans.
I know for a fact that this is going to be a very interesting conversation, especially to everyone listening to this. I'll pause you a little as we go on this break. We'll go on a break now. When we return, the show will continue. Don't go away. Welcome back. If you're just joining us, this is Health and Environment Insights, and our guest today is Dr. Gbelela Dolani. He's a special assistant to the special advisor to Ondo State Governor on health. Doctor, before the break, we were discussing the exposure of market products, and you were giving us explanations as to this, if this practice is dirty or healthy.
It's a very dirty habit, and I may sincerely need to repeat myself that the State Ministry of Health, Environment and Agriculture frown at this seriously, and we're trying as much as possible to do all that are legally possible. Ensure that we eradicate this type of marketing or exposing food items. And the reasons are numerous. I will start by saying that by the time we do expose these items, rodents, rats in particular, they play around it. Flies. They spit on it. They pass urine on it. They salivate on it. And if those rodents are the ones that can carry, for example, the Lassa virus, such individual will come down. Because often, not everybody uses this gari for boil the water and but you have people just putting it in the cold water before you do it and stopping it. And some people will come down with Lassa fever. And I also want to appeal that by the time you treat any form of fever, because the commonly cause of fever in this environment is what we call malaria. By the time you treat it conscientiously the way you're supposed to treat it by the medical doctor or the nurses, you give the appropriate drug. And the fever is not coming down within 3 days. We must be thinking of Lassa fever, not late presentation. You have treated it for malaria, you say it's resistant malaria, you started again, you said it's typhoid, you said it's this and that. And you start wasting time. By the time the symptoms become so enormous, such an individual will calm down and be done. So what exactly am I saying? As a survivor of Lassa fever, exposing food in the market or on the roadside, either the poporo or the fish or the gari, whichever one, or maize itself, is dangerous. It's a dirty habit that we must run away from.
Okay, I also know that these are challenges and there must be solutions. There are ways to avoid it, because basically that's what we're discussing today. Now that we know some of these habits, how do we avoid them? How do we overcome these challenges?
Like I said, habits is a recurring, often unconscious pattern of behavior.
Okay.
And for you to be able to change, you have to take it bit by bit and you follow the rules. Take for example, unnecessary littering of items in the environment. The government frowns at it. And you could hear it being said regularly. Items you sell in the market, you readjust, you start covering. And attitudes or behaviors, personal, like smoking, which is detrimental to your health, you readjust. You avoid the environment that lure you into it. Excessive drinking. Adventure is when you see your friend that they are taking it, that you are also going to join them in doing it. You try to avoid such a gathering, or you have a way of readjusting gradually. Before you know it, you adjust fully to good behavior. So it is not something impossible in the first place. But
one is intentional about it.
You have to be intentional about it, and it is gradual. And before you know it, you start conforming with good behavior.
Now, going by your office, in what way is government trying to enlighten people about these habits so we can avoid them and have a healthier and sustainable environment?
Thank you very much. Just like I said a while ago, I mentioned the statements from Health, which is also under the special advisor to Mr. Governor of Health, and we have met with them, we have reviewed most of the activities, and interestingly, the one that has to do with Lassa fever is something that is of great importance to everybody in the health sector in the state now, and we'll talk about it. The one that has to do with this same Lassa fever, you have staff from the Ministry of Health moving from one hospital to the other, talking to them on what they ought to do as healthcare workers. That is infection prevention and control at that level. And when individuals are sick, we also tell them where they should go at the time that the infectious hospital is there. And by the time hospital treats an individual that has fever for 2-3 days, and it's not prevented, it's not coming down, the fever keeps on going, hitting the roof, and the individual is not getting better. Quick referral. Until you develop a very high index of suspicion as a healthcare worker, and by the time you try to manage and it is not working, you quickly refer to infectious hospital. So all these are going on, and we also work with other agencies, other ministries, like the environment that I made reference to a while ago, so that we can continue